Good afternoon, everybody. Thank you for coming. We are here to give you an update on Zika virus. I know that everybody has been tracking what's going on around the world. At this time, it's really important to know that mosquitoes are not active in the winter months. And so here in New York City, there's really virtually no risk of transmission of Zika. We, like other cities across the nation, have been experiencing some cases of folks who travel, because folks travel, especially during the winter months, to warm climates, who have contracted Zika elsewhere and come back to their home residence. Because of this, we want to make sure that we stress and emphasize that women who are pregnant or thinking about becoming pregnant really are strongly encouraged to delay their travel to any countries where Zika transmission is currently happening. That is critically important. And for all travelers traveling to those countries, which are primarily in Central America, some in Mexico, and in South America, that folks take appropriate precautions, all the mosquito precautions that we've highlighted. And now I'm going to turn it over to Commissioner Bassett to really update you on some of the specifics that are happening here in New York City, and then we'll take questions.
Thank you, Deputy Mayor. And I want to reiterate the Deputy Mayor's remarks and acknowledge to all of you that this is an evolving situation in which there's much that we know, and also there are things that we don't know. So we are here to share with you what we're doing. Yesterday we were informed of a laboratory-confirmed case of Zika in a pregnant woman who traveled to an area with ongoing Zika transmission. So that brings to 3 the number of New York City residents who have been diagnosed with Zika. As the Deputy Mayor has noted, there is no risk of acquiring Zika virus in New York City. The mosquito responsible for the transmission in areas of Latin America and the Caribbean is Aedes aegypti, which is a mosquito species that we do not see here in New York City. And of course, additionally, mosquitoes aren't active in the cold weather months. All of the patients that we've identified here in the city have traveled to other countries which had known Zika transmission that was ongoing. So I want to reiterate that New Yorkers who travel to countries which have Zika transmission are potentially at risk, and they should take measures to protect themselves from mosquito bites. And in particular, and this is very important, it's something that we want all of the media to assist us with, we want to strongly advise that pregnant women or women who are considering becoming pregnant consider delaying travel to affected countries until we understand more about this virus infection. Pregnant women who've recently traveled to affected countries should consult their doctor. I now want to take a moment to go over with you some of the steps that the Health Department has already taken and the steps that we will be taking going forward. We have issued 2 health alerts, which is our form of communication with healthcare providers. We've issued 2 of these in the last 2 weeks to a wide range. Our email list has over 20,000 providers on it, and advise them to check for symptoms of Zika virus in patients that they see who have traveled abroad, and to promptly report any cases to the Health Department for further investigation. We also created a Zika travel alert for pregnant women, and it's available online. We have it available for you today. We have it in English and in as well as in 9 other languages, and we have been actively distributing this travel warning for pregnant women in many different outlets. Our community affairs team has contacted community and faith-based organizations around the city to educate the public about the risks of traveling to affected countries, and we've been using social media, Twitter, Facebook, our website, to educate the public about this, about the risks associated with travel. Moving forward, we're going to be working in two ways. One, of course, is tracking New Yorkers who may be infected with Zika, which they've acquired during travel to other places. And second, we are going to be enhancing our surveillance for species of mosquitoes that might be capable of harboring the Zika virus. Of course, as I've said, Zika virus infections is reportable to the health department. During the mosquito season, which begins in April, so we have some months ahead of us, the department is going to build on its very comprehensive infrastructure for West Nile virus mosquito control and adjust our strategy so that we can ensure that we understand and control Aedes mosquitoes. Should the Asian tiger mosquito, which is Aedes, excuse me, I've mispronounced it, Aedes, mosquito, which is in New York City and may carry the virus. We are going to be consulting with experts, both on the clinical presentation and diagnosis of Zika virus, and with entomologists on better understanding the Aedes vectors and issues and consulting with them on issues of mosquito control strategies. We're going to be reaching out to our counterparts in the southern part of the United States, where Aedes aegypti vector has been identified, as well as counterparts in the Caribbean, to learn about their efforts in mosquito control. Finally, we're increasing public awareness about the disease through our communications with physicians, providers, elected officials. I want to acknowledge that our Health Committee Chair, Corey Johnson, has joined us in the room, as well as community-based organizations. We're particularly interested in reaching out to communities in which we can expect there's frequent travel to areas where there's ongoing Zika transmission. We are planning a public awareness campaign that focuses on how New Yorkers can protect themselves from mosquitoes. And we, of course, I want to reiterate again that it is really important that we get the message out to pregnant women about the potential risks of traveling to areas with Zika infection transmission, and to communicate to them that we strongly advise that they postpone travel to these areas. I want to express our hope that the media will help us spread the word about this, and thank you. We'll be happy to answer any questions.
I did want to just stress a couple of things. One is, as Commissioner Bassett indicated, this really is an evolving situation. There are things that we absolutely know. We're going to be very clear with you about things that we know, but there are things that are just unknown about Zika virus and that we will be learning as we move on. The other important thing is that we've learned a lot of things around mosquito control, and there's a great infrastructure that we have here in place. Now, the mosquitoes that transmit West Nile virus have a different pattern of biting than the mosquito species, Aedes mosquito species that can transmit Zika. So we will be updating our enhancement for the Aedes species, and we will be updating a strategy to make sure that we're prepared. We are cautiously optimistic because we live in a very temperate climate and we don't have Aedes aegypti, that we will not have a big transmission here in New York City. We will continue undoubtedly to receive folks who have been infected elsewhere and come here, but that's different than having transmission here. But while we're optimistic, we are simultaneously preparing to make sure that we do everything we can to stay ahead of this and to protect New Yorkers. And with that, I'd really like to invite Councilman Corey Johnson to come up and join us. Thank you very much, Councilman. We appreciate your being here.
The CDC says that there's a theoretical risk of sexual transmission. What's your opinion on that, and are you monitoring the potential that it could be sexually transmitted in New York City?
Well, as you have no doubt read in media reports, there have been 2 case reports that seem to be consistent with sexual transmission of Zika. This is something that we will learn more about as we go forward. At the moment, I think the important message to get across is that this is a mosquito borne infection, that it's an infection that people acquire from mosquito bites in areas which have ongoing transmission from Aedes aegypti that are infected with Zika.
Commissioner, what can you tell us about this latest case? What country did the pregnant woman travel to, and how far along was she in her pregnancy? Is her baby in danger? What do we know?
All three of the patients that we've identified with Zika infection in New York City travel to areas which we know are on the list, a list that is evolving, and the number of countries are increased. She was in a country that we know Zika transmission occurs, and more than that, in the interest of protecting a patient's privacy and confidentiality, I think that's all I can say about her. My goodness. Well, as you know, the infection has been reported in the South Seas, in Africa and Latin America, and the Caribbean. I'm not sure which ones of those are a continent, but...
The CDC said today that 33 people who are infected in 11 states, from 33, 19 were in Puerto Rico. So could you tell us if any of these people who are infected in New York went to Puerto Rico, Dominican Republic? I know you're trying to protect their...
That's right. And Puerto Rico reported transmission in December of last year. And of course, we have a large Puerto Rican population in New York, and it's very important that people be aware, if they're planning travel to Puerto Rico, that they need to protect themselves from mosquito bites. And that is true for every other place where we have documented transmission. So New York City residents travel a lot. As the deputy mayor has said, travel to warm places in winter months is something that New Yorkers often look forward to doing. This might be a good winter to think about a vacation in the Catskills.
And I think it's important not to get caught on a specific place. I think, as the commissioner has stated, these countries are evolving where we are learning more and more. Transmission is spreading. And so it's important for travelers to stay updated, to visit the CDC website, because new countries get added to the list as they're identifying. So it's important for travelers to be very aware when they're going to a region where there might be transmission, and to make sure that they take good precautions.
Commissioner, do we know how exactly the mosquitoes are spreading? Because they would have to be spreading to these countries in order for us to be seeing all these cases.
No, this is a very widespread mosquito. Just as it's widespread even in the United States, in the southern states. But we have not seen this particular subspecies of Aedes mosquito in New York City. So it is thought that it originally came from Africa, but it is now a mosquito vector that's seen all over the world.
So the way the virus, it's infected people get bitten, that mosquito will then carry the infection when they bite somebody else.
So if someone comes here and is infected and gets bitten by one of our mosquitoes, could that mosquito then go and bite?
So that is the theoretic possibility. So what we're saying is that we haven't seen that happen in temperate climates. That is what is happening in those countries that are there, is that you're seeing transmission go from a person bites a mosquito, then bites another infection. That bite has to happen while the person, we think these are the things that are unknown completely, but generally speaking, that bite, the first bite has to happen while the person is sick and has virus in their blood, and then the mosquito will bite somebody else. Generally speaking, you have to have both a lot of people, a sort of what we call a critical mass, many people, not just a single person who's infected, and a lot of mosquitoes who are biting other people sort of at the same time. We haven't seen the particular species. We've got a relative of that species of mosquito, but the particular species that's currently very active in transmission, we don't have here in New York City.
Commissioner,
Yes.
so far we have 5 cases in the state, 3 in the city. But in the event of a major outbreak, if there is by any chance a possibility that there is a lot of more cases, what then could be done to answer a situation like that? How well prepared are we to face maybe a very fast growth on the reported cases?
So let me just reiterate again that every case that we've had identified in this city and in the state are people who traveled to a country where there was ongoing Zika transmission, and they acquired it there. And then they came back here and were diagnosed here. So we haven't seen any evidence of transmission that's happening based on a mosquito here, a New York City mosquito. We do know that chikungunya and dengue are sort of similar viruses that are also mosquito-borne viruses, and it makes us optimistic because we also haven't seen transmission of those in our city. So I think what you're expressing concern about is the idea that it might enter a vector here in New York City. And that's what the deputy mayor was just describing, that we are going to build on the infrastructure that we already have, very robust infrastructure for West Nile virus control, and extend it to this species, Aedes mosquito. The related one in New York City is also known as the Asian tiger mosquito. And I'll turn to the deputy mayor to remind us of the Latin name.
Aedes albopictus. And really it's important, you know, when we talk about the robust infrastructure that we've got here, that includes not just the work that the health department is already doing in terms of human surveillance and making sure that physicians are reporting cases of West Nile virus or reporting any cases that they might see of Zika. But it's really about surveillance of mosquitoes, and it's understanding where are mosquitoes and how does that need to direct our pesticide applications and our strategies to control mosquitoes. This mosquito is different, so we will be updating our strategy to be able to enhance our surveillance of Aedes, which is a different mosquito that carries West Nile virus, and to be able to make sure that we revise our strategies around control in a proactive manner. This is out of an abundance of caution that there is the possibility that the species that we have here may become a vector. We have no evidence at this time that it has become a vector. We are optimistic, as the commissioner just said, that because we haven't seen dengue or chikungunya, we are optimistic that we will not see Zika transmission happening here, but out of an abundance of caution, we're going to be enhancing our surveillance and our control measures.
Is it proven or just suspected that the Zika is causing the microcephaly?
I think you've heard it said over and again that it's not yet proven. The evidence is based on the temporal association with the extensive spread of Zika in Brazil and the very steep rise in the number of cases of small heads or microcephaly in babies born to women who were infected.
Women in the United States who are pregnant typically have a couple of ultrasounds. How early in a pregnancy can an ultrasound pick up that condition, microcephaly?
The recommendation for the CDC for pregnant women who return from areas where Zika transmission is ongoing, who may have been exposed, is to consult with their doctors and to consider regular follow-up. It's really looking for the rate of growth of the head and the brain that needs to be done. Are you asking about what trimester and the first trimester?
It could be picked up in the first trimester.
Yes.
Commissioner, how many cases of Zika were found in New York last year or 2 years ago? What's typical for New York to see?
Oh, these are the first cases that we've documented, and that's one of the challenges. Yes, ever. That's one of the challenges that we have is that we're lucky here in New York that we have both the state lab and the Centers for Disease Control lab, but there is no rapid test for Zika. It has to be done in special reference laboratories.
Is there any recommended change in hospital policy and ERs to screen pregnant women differently, ask where they've, is the standard operating procedure changing at all?
Only related to travel. As you all know, it's a really important question. All of you who went through the Ebola virus concerns, that that we ask people, have you traveled recently? And that's an important question that we want providers to ask all pregnant women. And so this is really an algorithm that's only triggered by a history of travel to an area where there's ongoing Zika transmission, a list of countries that's continuing to grow.
And many people who get the virus are asymptomatic, right? And never, quote, become ill.
That's correct.
And it's important in terms of the guidance that, remember, even those clinical guidances are being updated. So much of the guidance, again, because as we learn more, as the CDC learns more, as the World Health Organization learns more, as we learn more here in New York, guidance will be updated.
Could you clarify just how different pesticide spraying might be this summer compared to the last previous summers to deal with this?
Should I start, or you want to start? Or?
Sure, I can start. So, we are fortunate in that we are right now in winter. So we have time to enhance our strategies. And it's important to know that it's not just that we're building on West Nile, but we've already started to expand into the area of learning more about 80 species because of what was happening in the south around dengue and chikungunya. So some of that work has already begun. As the commissioner already indicated, we will be convening the city will be convening panels of experts, both around the clinical expertise around imported cases and the clinical implications and the disease epidemiology, but also around the mosquito control, both in terms of what are the best surveillance methodologies and what are the types of enhancements or any changes that we might need to make sure that we are targeting the right habitats for these mosquitoes, which are a little bit different.
I mean, are you expecting a lot more sprays?
So, I think so I would answer that what we're expecting is to be able to tweak our control measures, which is more than just spraying. It's really around the different types of control measures to make sure that we are targeting pockets of albopictus, of Aedes albopictus.
A big difference between the Culex mosquito, the West Nile mosquito, and the Aedes is the biting pattern. The Aedes are frequently described as aggressive biters. They bite in the daytime as well as in the evening, whereas West Nile is mostly an evening biter, so that's why our spraying has been mostly in the evening hours. And so a question that we'd have to consider, and this would only be if there was reason to be concerned about Zika transmission, would be the timing of spraying. And I need to correct myself. There was one case of Zika diagnosed in 2015.
And it's important, actually, here the public can really do a lot. So the other thing about Aedes is they breed in very small pockets of water. So, making sure that you don't, it's outdoor pockets of water. So Aedes is kind of an outdoor, it's a day biter, but it also likes to live in outdoors with a lot of vegetation and small pockets of water. So don't leave, open pots. Make sure that you're draining. Make sure that you're changing water. That is really, really crucial to controlling Aedes breeding in New York City.
That breed is more aggressive. Would it respond to the same sort of pesticides used in the spraying?
Yeah, it's aggressive in terms of when it bites. So it's not that it's more aggressive in terms of being a more hardy species in terms of being resistant to the pesticide application. We call it aggressive in the, we as humans perceive it to be a meaner mosquito because, they'll dive bomb into you and bite you. Those are the mosquitoes that are out there being a nuisance and biting you all day long. So that's what we mean when we use the word aggressive.
Screening. Are you recommending screening of people who come back from these countries who are not pregnant women, who might have symptoms? And also, what about screening at airports, et cetera? Do you think we would get to that point where you would have, because we have a lot of travelers coming from these countries here, where you would, ever get to that point where you have to?
The recommendations for testing are only among people who develop symptoms related that are typical of Zika. So those are the symptoms of abrupt onset of fever, a rash, a sort of raised rash, red eyes or conjunctivitis, and pains in the joints. Those are the typical symptoms of Zika there. And of course, the timing of when you develop those symptoms are important for pregnant women. The recommendation is for testing if they have those symptoms within 2 weeks of return from an area with known ongoing transmission. There are lots of steps that people can take to protect themselves from mosquito bites. And it's worth noting that using insecticides, wearing long sleeves and covering, sleeping under mosquito nets, having screened rooms. Those are all steps that people can take to avoid bites, and that's recommendations for everyone. Of course, we're particularly concerned about pregnant women because of the reports from Brazil, and that's why the recommendation for them is that they consider postponing travel to areas where there's Zika transmission.
How did it happen that these 3 cases were diagnosed? Were they feeling sick? They went to their doctor and they were diagnosed? And what were the dates of diagnosis?
I can't give you the dates of diagnosis, but they've all been recently. The case in the pregnant woman was reported to us yesterday. All of them had symptoms consistent with Zika. That's what we're asking providers to do, to contact the health department if they have a patient with travel and symptoms consistent with Zika infection, to contact us, and we assist them with doing the evaluation, including laboratory testing.
And it's recent travel with symptoms.
Yeah.
The mosquito question that you touched on sort of, but some clarity. We know that there's one species that currently has the Zika virus, but is it likely or possible that another species could develop it? And if a different, so if I have Zika virus and a different species of mosquito bites me, will that new species then get the virus potentially?
So this gets a little technical, but so it's a complicated situation, right? You have to have multiple things happening at the same time. So the species that we're seeing in the, Latin America is Aedes aegypti. It is sort of commonly known as sort of the yellow fever mosquito. What we have here is Aedes albopictus. We also have a much cooler climate overall, so it's not just the mosquito, right? So there's the mosquito species itself, there's the climate that's happening. We haven't, so it's theoretically possible for Aedes albopictus, and I think that there may have been in some other areas some cases of transmission, but those are much warmer, sort of southern climates. So it's a relative of aegypti. We don't have aegypti here. But because we're also cooler, we think that there's a lower risk of us really getting into that point of sustained transmission here locally as opposed to people coming in from travel abroad. Again, but out of an abundance of caution, we want to make sure that we're being very proactive, that we, especially because we do recognize that there are some things that are not known yet. So in that status, as we learn more information, we're casting a broad net, to use a bad metaphor, to make sure that we are doing everything we can, both in terms of the clinical aspects, but also in terms of building on our mosquito control infrastructure.
So we want to sort of understand better the ecology of Aedes albopictus in New York City. We want to be able to think about how we can best identify breeding sites. And these are things that we'll consult with others about. And just to remind you, we do have time because we typically think of the mosquito season as beginning in April.
Making any preparations like in NICUs, et cetera, for an influx of children, babies, infants who are born with complications?
We're hoping that we can get the word out to encourage pregnant women or women who are considering to becoming pregnant to postpone travel to areas where they might acquire Zika. They will not acquire it in New York City. At this time, there is no transmission of Zika here in New York City.
I think there might be a need to widen screening because 1 in 5 people who actually have the virus don't show symptoms. So theoretically, someone who isn't showing symptoms could be bitten by a mosquito and then spread it that way.
For that reason, we're advising all pregnant women who return from areas where there's ongoing Zika transmission, consult with their doctors and consider a course of having regular sonograms done.
How many species of mosquitoes are in New York other than Aedes albopictus?
Oh, there must be many, many. We have a wonderful entomologist who could give you that number right away, but there are many, many species of mosquito. Of course, the most common ones are the ones we refer to as nuisance mosquitoes, which carry viruses. But there are many types of mosquitoes in New York City.
Is the only one that can.
That's correct. That's the one that we want to keep an eye on and better understand its distribution and its breeding habits.
You're saying that because of the cooler weather here, the mosquito is not going to breed as much? Is that what you're saying? I mean, or is it the length of how the warm season here that it's not enough time? Why is the cooler weather a factor in the spread of this in terms of those mosquitoes?
You know, I can say that I personally don't know, and I'm not sure that it's that the entire ecological cycle is well known enough. But we have not seen other similar diseases that are in this species. We haven't seen sustained local transmission, right? Which is really what we're talking about. Is happening in those other countries. So sustained local transmission, where you have folks being infected right here locally. We just haven't seen it in those temperate climates.
And we haven't seen it for dengue and chikungunya, even though we've had many people come back to New York City with those infections. Hasn't made it into the vector.
Could you just clarify how many cases there are in New York with the third case?
In New York City? New York State? Well, the number keeps changing. So I thought coming in here that we had I know that we have 3 in New York City and 4 in New York State, but the gentleman here suggested that we now have 5 outside of the city. The number for New York City is 3. And I understood the number outside of New York City was 4. So I think we should all just check that from the state. But we can expect there to be more cases because it is a widespread and increasingly widespread infection in many places that people commonly travel to, either to visit our city or to returning home to our city. So we can expect that number to increase. I just want to reiterate again that we really want to get the message out to women who are pregnant or who are considering becoming pregnant that they should be cautious and consider postponing travel to countries in Latin America, the Caribbean, and elsewhere where we are seeing Zika.
And the last point I wanted to make too is just in sort of making sure that we have a well-balanced and accurate message is that by and large, Zika virus infection really produces mild illness in most folks. So the concern about pregnant women is new and real, and we want to make sure that we are very cautious about having that population protect itself. But that for the average non-pregnant person, even if you do contract Zika while traveling, it tends to be a very mild and self-limited illness. That said, we want all travelers to take good mosquito preventive actions for themselves and their families whenever they're traveling, not just for Zika, but with the large number of mosquito-borne diseases that one can contract during travel.
Thank you.
Thank you.